Good evening, and welcome to the main event of Rutgers Global Health Institute's first ever Global Health Case Competition, The Pitch. Let's meet our 8 dynamic teams. 10 weeks ago, the people you're seeing here came together for the first time as a team. They started as strangers for the most part, who shared a connection to Rutgers. They are students and faculty in many different schools throughout the university. They represent a wide range of academic and clinical programs, from health professions such as biomedicine, public health, nursing, and pharmacy, to communication, finance, history, urban planning, engineering, and social work. Their dedication to global health has united them. And in these 10 short weeks, they've transformed into teammates. They've transformed their thinking and their problem-solving skills as well. They work together to tackle very real issues related to COVID-19 and its impact on vulnerable communities in New Jersey. They've challenged one another, agreed and disagreed, and maybe even turned off their Zoom camera so no one would see them banging their head on the desk. Group projects are hard, but teamwork transforms lives. Teams, thank you for your enthusiasm throughout the case competition, and we look forward to seeing that same energy in tonight's pitches. We know that you can transform our world. Now, let's meet our panel of 7 judges who are members of the Rutgers faculty and community leaders in our great state of New Jersey. Manuel Castaneda, Kevin Lyons, Richard Marlink, Mariam Merced, Kelly Moore, Harsha Sule, and Michelle Wilson. The judges will be seeing the pitch videos for the very first time tonight. After each team's 5-minute video plays, and everyone tuning in will watch it together, we'll go live to our judges and teams for a short question and answer session. We'll repeat this for each of the 8 teams, then take a short break while the judges deliberate. Then we'll all return to the main stage to find out who our winners are. And now everyone needs to navigate over to the sessions area of our event platform, where we're about to get started with Team 1's pitch.
The COVID-19 pandemic has exacerbated housing insecurity, which is a long-standing issue facing marginalized communities in New Brunswick. Systemic inequalities facing undocumented immigrants and non-English speakers have made them especially vulnerable to leasing or housing issues that impact individuals' mental and physical health. New Jersey does not require a written lease for renters, which can lead to arguments surrounding the contractual agreement and issues with non-English speaking families. In response to COVID-19, New Jersey has implemented an eviction moratorium through June 17, 2021. As this date approaches, the demand increases for those in need to have access to legal and social guidance with their housing and leases. Furthermore, rental overcrowding and lease emissions have led to unsafe living conditions. Worsening this situation, 40% of U.S. adults are affected by unemployment, which links to the inability to afford rent for 1 in 5 U.S. populations. We propose to directly address the vicious cycle of evictions, housing, and rehousing that can be so dangerous to already marginalized people groups. Our proposal is to place a master's student from the Rutgers School of Social Work at Unity Square, an existing initiative in New Brunswick that provides social and housing care to low-income residents of the area. The student will serve as a resource for housing concerns, which will be accessible to low-income families in this community.
Our intervention stems from a housing-first model, which uses housing as a gateway to improve other aspects of clients' quality of life. Studies have shown that families who are already housing insecure tend to rush to find inadequate housing solutions that lead to a lack of protections written into a lease. By offering assistance rooted in social work training, the Masters of Social Work student can assess any risks associated with new leases and help families overcome barriers to stable housing. This assessment will enable Unity staff working with the student to intervene earlier in the cycle of injustices that could leave a family in the streets. These social work students will have an opportunity to take a self-directed approach, although they will be guided by a field placement supervisor, someone who is usually a licensed clinical social worker with experience addressing the issues that could come up during placement. Doing so will leave students with a stronger understanding of the needs of the communities and how to form connections with various resources. As we developed our approach, we knew we wanted to be flexible. The students, by working with each client, are able to provide individualized care optimized for every person.
We'll implement the housing and lead support through a partnership with the Rutgers School of Social Work. We'll work with the Field Placement Office to establish Unity Square as a field placement site for students in the master's program. Unity Square can accommodate at least 2 to 3 students in a given week. The field placement normally lasts for at least 2 semesters, depending upon how many hours the students can devote. We'll also make sure we're structuring the program to be specific to the community Unity Square serves by recruiting students fluent in Spanish who can be available to serve the community members in the evening when they're out of work and most likely to be at the center. Coordinating the placement with the Field Placement Office should be relatively quick, and assuming we start before summer 2021, we can get this up and running by the start of fall 2021 semester. The students' main responsibilities will be to review and potentially translate leases for community members, generate housing leads, advise on improving the health and safety of existing housing, and connecting tenants to other community resources.
One of the other benefits of this approach is its inherent sustainability. There are no upfront or significant recurring costs required to keep the program running, since there are already electronic resources and computers at Unity Square. By partnering with the School of Social Work, there will be a continued stream of master's students who are incentivized, motivated, and well-trained to perform the work. Our plan is also resilient to uncertainty. One risk we identified is that there may be a lack of interest among the current social work students in choosing to complete their fieldwork placement at this site. We have a couple ways to address this challenge. First, we'll work with the placement office to understand any concerns the students have voiced or what questions they're asking about the placement. This will allow us to make sure we're putting forward an opportunity that can be engaging and enriching part of these students' education, while also meeting the needs of members of the New Brunswick community. Also, we want to make sure we're reaching the community members who need these services. By partnering with Unity Square, we can take advantage of their existing community expertise and relationships through their various outreach efforts to publicize our program. COVID-19 has made life more difficult for thousands of the most vulnerable families in New Brunswick. Our hope is that by implementing this housing resource through an existing initiative in New Brunswick, we'll be able to directly reach those individuals who have been impacted not just by the COVID-19 pandemic, but existing systemic inequities. We can't wait to get started.
Okay, great job. Sorry about the technical difficulties. I had nothing to do with it, but it was still very good, well content. So now we're going to ask some questions. We have 3 minutes. And so our judges are all assembled, and we're going to type in the chat our questions, and then we'll give you guys some time to respond. So are you going to use graduate students? It sounded like you are, but can you confirm that?
Yes, Field Placement Office is for placing Masters of Social Work students, so there will be graduate students.
Okay, and again, I think I heard this, but how many graduate students are we talking about?
So Unity Square can accommodate anywhere between 1 and 3 students at one time, depending on how many hours each student is there. So if they're each there, for a full time, maybe 2, but if folks need fewer hours, it could be more students, but usually just a handful.
Excellent. And you had mentioned the idea of this being something that the graduate students may or may not want to do based on what their studies are. But I think, being able to utilize career services and such and academic services would, entice them. Is there anything else that you guys can think of that would really make this exciting for grad students to do?
Yeah, I think one thing we wanted to do was to work with the housing office or the field placement office and sort of make sure that if students are giving any feedback in terms of it not being exciting to them, we can sort of directly address those things and sort of tailor our program to make sure that it's well suited to social work students' needs. That's preparing them for their careers and as part of their education. So definitely having that dialogue, I think, will be really helpful.
Okay, I think we might squeeze one more in there. So some housing issues time to time resolve. Do you guarantee continuity of assistance in these cases? So, they're being resolved, but now how do you transition?
Oh, so are you saying?
You know, beyond the assistance that you're providing the continuity on these cases.
Yeah, our placement takes place over a full semester, over a full year. So most of those could hopefully be resolved in those kinds of time. But there are actually also staff at Unity Square who could assist and could sort of serve as that continuity. So that there's not this, a lot of the knowledge or case-by-case information doesn't just reside with each graduate student. There's also staff there to sort of assist and be the home base of operations.
Okay, well done. And I think I have time for one more question. So how again will the clients be identified for this program?
We'll be working with the Unity Square staff to identify the clients who are in most need for these kinds of cases. And they'll be sort of the ones who can shepherd and publicize the program to the clients who they think will find the most use for it.
Okay, and wait, time is up. Sorry, I had a zinger in there, but you guys did really, really well. I really appreciate it. So now we're going to go and do our judging. And thank you again for your participation.
Thanks.
We're Team 2, and we're here to pitch our solution that addresses the pediatric mental health crisis amid COVID-19 in New Brunswick, New Jersey. We intend to explain the following and eventually provide a solution to addressing pediatric mental health in our defined population. New Brunswick is unique because of its large foreign-born population, which makes up 38.3% of the city. Nearly 50% of the population identifies as white Hispanic, many of which are Spanish-speaking. The poverty rate is currently 34.2%. The city also has a low elderly population and a lower than average percentage of households with a computer. As we're all aware, COVID-19 has had devastating effects on communities such as New Brunswick. Racial and ethnic minority groups have also been disproportionately affected by the virus. There have been various sociological, economic, psychological, and educational effects of the pandemic since the statewide public health emergency last year. These effects include, but are not limited to, misinformation to vulnerable populations such as minority groups and LGBTQI individuals. We would now like to introduce you to Julio, an 8-year-old boy living in a crowded home with his Spanish-speaking single mother. He and his family are undocumented immigrants. His mother does not have a laptop or tablet for him, so Julio uses the limited data plan on her cell phone to call into class. He often loses connection and gets frustrated. Can you imagine the mental health effects Julio's situation is causing? Children have been largely affected due to the impact of COVID-19 from common effects such as virtual learning, undocumented citizenship, and language barriers, plus more, which leads us to our problem statement. Amidst school closures and the impact of various social determinants of health, children have suffered numerous unintended psychosocial effects due to COVID-19. How do we help children like Julio in New Brunswick?
To help children like Julio, our group reached out to local community partners and businesses because they are familiar with and are a trusted part of the community. We were able to get in touch with a local community program named New Brunswick Tomorrow, or NBT. Diana Tapia, one of NBT's program associates, works with the Esperanza neighborhood, where a large community of Latino immigrants reside. Tapia mentioned that there is a need for technology within this community, especially since school is online. To address the rise in pediatric mental health issues and need for electronic devices in New Brunswick, we developed a 2-part solution named Recovery Squared, which aims to assist the pediatric population during their recovery from mental health issues through the recovery of computers. The technological aspect is achieved through the 3 R's: receive used computers, replace computer parts, and redistribute refurbished laptops filled with pediatric mental health resources in English and Spanish. Mental health recovery is an ongoing process. With Recovery Squared, we are providing families the tools and education to continue and sustain that recovery long after we've distributed the devices. For the second part, Recovery Squared will be targeting middle school and high school age groups because through our research, we discovered there is a lag between mental health issues and receiving help, especially for the transition age group. Therefore, it is important to provide linkages between the community, youth, and providers for prevention and intervention. To achieve this, Recovery Squared will provide easy access to free community resources, such as telehealth.
So far, we've defined the problem and discussed our solution. Now let's talk about implementation. As you can see, we place great importance on creating connections within the community to better develop and strengthen the linkages between mental health providers, resources, and the community. There are also several stages that deal with logistical issues like device repair and distribution. And finally, because social connection is such a large component of mental health, particularly for youth, we'd like to plan and host safe community events and volunteer opportunities. So, why should you support Recovery Squared? Well, for one, it's cost effective. How many of us have old devices lying around the house gathering dust? I know my family sure does. Recovering devices is not only cheaper than buying new, but it's also environmentally friendly. It's sustainable. By partnering with trusted community organizations and utilizing existing resources, we can focus on increasing awareness and access to those resources. With donations, volunteers, and community champions, it's a flexible and scalable model that can be adjusted to address community needs and provide culturally relevant resources where they are most needed. So, what are you waiting for? Come join us as we leverage the power of the community to recover the mental health status of children in New Brunswick, one recovered computer at a time. Thank you.
Well done. So now we're going to go to Q&A. And in a few seconds, we'll see our first question and I'll power it off to you guys. Okay, so Dr. Moore has the first question. So who will assist the youth in the technology aspect? Meaning that now that you got the technology, who's going to assist them with, okay, this is what it is and this is how it works?
I guess I'll answer that. So for the assisting the youth in the technology aspect, we're planning on gathering volunteers from places like the School of Engineering and any other volunteers who want to be involved in the process of fixing computers. So that may be like people who maybe computer science students want to be involved. So it's a win-win on both aspects. We can teach engineering school students any technical things like that, any practical real-world experience. Also teach the community as well. These middle school, high school students, their technical skills as well. So yeah, it's going to involve both the community as well. We'll ask the community, but it's going to involve Rutgers students mostly first.
Okay, great. Next question. Besides the number of computers recovered, how else will you measure the outcomes?
So with our project, we did a lot of community outreach, and the people that we contacted was one of the New Brunswick school nurses. So I guess having like a large community presence, we can ask people who work directly with the New Brunswick population, like if things are helping or what else what else we could put on the computers in order to help them. So I guess a lot of community outreach with that and just asking the people who work directly with the kids.
Okay. So as far as the cost involved with the repairs, is that the burden that the person who's doing it is going to have, or is there a way to fund the various costs? It's going to be different for each system, I'm sure.
Yes, I'll answer that. The refurbishing costs, we're going to use a combination of local donation as well as corporate sponsors. So we actually have a list of corporate sponsors. This has been done in some sort of variation in the past by the Rutgers School of Business. So we've contacted PDW, which is a large corporate. We've contacted HCM Enterprises, and they're willing to donate, I think. And we are also in contact with Dell. So these community partners, we can also rely on them to really cut down on the cost. And for repair costs, it's not really that expensive initially. We're not repairing too much of the computer, we're refurbishing it.
Okay. And then real quickly, what type of mental health resources are you referring to when you mentioned that?
We're hoping to connect with mental health professionals in gaining those resources. We haven't yet accumulated them, but we'd like to reach out to different communities out there.
Okay, we've reached our end of our much. Well done, and thank you for the time that you put into this.
let us introduce you to Project Breaking Bread. According to Feeding America, today there are more than 80,000 food insecure individuals residing just in Middlesex County. Despite the work of countless food pantries, approximately 10% of New Jersey's population still doesn't know where their next meal is coming from. Through further conversations with our community leaders, we learned that how severely COVID-19 has increased food insecurity in New Brunswick. During this pandemic, our community has opted for mobile healthcare and mobile schooling, so we thought, why not mobile food pantries? Our vision is broken down into 3 tiers. Tier 1 focuses on distribution in the community. Tier 2 focuses on collaboration and food collection. And Tier 3 will discuss future sustenance and a functional community green space.
Tier 1 of Project Breaking Bread aims to implement a mobile food pantry distribution service. The distribution service will reinforce work of our food pantries and offer immediate relief to the community. Using GIS mapping and available census data, we will determine stops for the van that yield the highest impact. Within the first 6 months, our goal is to sustain at least 20 scheduled drop-off locations across New Brunswick each week. Food that is to be distributed will be collected from our food pantry partners across the township. Essentially, our food distribution vehicle will serve as the middleman to bring the pantries to the people. Enthusiasm towards our project from local organizations has further strengthened our beliefs that this type of food service is needed in New Brunswick.
Tier 2 aims to facilitate smooth cross-communication between our distribution service, the food banks, and our community. Our app is focused on 3 main categories: data collection and analytics, schedule and messages, and calendar and feed. Our app functionality differs based on the user and can be viewed in various languages such as Spanish and Hindi. At each stop, drivers can simply tap on the orange button to record the number of meals served. The prescriptive data analysis will improve food truck operations and will allow the municipality to better allocate resources. The app also allows food pantries to schedule their desired pickup times. The calendar will show the weekly food delivery schedule with notifications reflecting real-time location. The community feed will show COVID-19 information, community resources, along with feedback forms and social media updates.
Tier 3 goal through Breaking Bread is to propose a long-term sustainable community aquaponics system. An aquaponics system contains a sustainable garden of fresh produce grown in water, fertilized by a fish tank working symbiotically to grow organic produce using 90% less water and a quarter of the space. Our nonprofit partner, Seed to Stewardship, has agreed to donate all labor to build an aquaponics system for the city that will supply fresh, free produce for the community. This potential local green space will provide local produce for years to come.
We estimate that in order to get the program off the ground, we will need to raise approximately $50,000. Of this initial budget, 64% is allocated to the purchase and implementation of the vehicle. 10% is allocated to the Breaking Bread app development. 23% is allocated for future sustenance and our community aquaponics initiative, and 3% is allocated for miscellaneous expenses that include permits. To raise that money, we hope to offer sponsorship opportunities to corporations in our community. Inspired by Mercer County's mobile food pantry program, we propose corporate sponsorship packages in exchange for advertisement on the vehicle. We plan on applying for the Community Development Block Grant, as well as federal and private competitive grants. Currently, we're also in discussions with Sustainable New Jersey for funding for our aquaponics initiative. And until we reach our fundraising goal, we are also considering renting or revitalizing an older vehicle to immediately implement distribution services in our community.
Our outreach plan includes QR-coded flyers with schedules and pertinent information to be posted inside houses of worship and public places around New Brunswick. Ads will also be featured in local newspapers and radio stations. Volunteers will also strengthen the workforce needed to carry out this program. Our tentative 2-year timeline includes immediate implementation of food distribution in Tier 1 within 6 months and gradual ramp up of Tiers 2 and 3. Further, our logic model will allow us to keep track of the program's progress.
Breaking Bread has the potential to efficiently address food insecurity and serve our community right when they need it the most. Feeding America has predicted in 2021, 1 in 8 adults and 1 in 6 children will experience food insecurity. Breaking Bread can change this narrative by proposing innovative multi-tiered solutions with the eventual goal of expanding across the state. Thank you.
Well done. Thank you very much, guys. So I'm going to be monitoring the chat box here for our first series of questions. So they should pop up any second now. This is a quick one. How much is it going to cost to pay for the app?
We plan to outsource the development of the app, and we estimate it will cost $4,000.
Okay, great. Okay, so more questions are popping in now. So how do you plan to sustain ongoing costs of the truck and the app? After the initial costs, of course, then you got to sustain it after that.
Sure. Yeah, I can take that question. We basically were able to secure the fundraising model for Mercer County's really successful food distribution program. They've been able to sustain their program using annual sponsorship. So they have logos that are actually magnets that go on their vehicles, so they can kind of be rotated every year. So hopefully that will sustain us each year and allow us to kind of broaden our corporate sponsorship.
Okay, great. Next question. Can you explain a little bit more about your timeline for who will be applying for funds and who do you propose will be responsible for the mobile truck?
At the onset, we would hopefully be in charge of overseeing the implementation of the initial program, but our eventual goal is to have a secured partner, whether it's a student organization, Rutgers University themselves, the city of New Brunswick. We want to have a stronger partner within the community so that it'll just reinforce whatever our program is doing. And I'm sorry, I think there was another part of your question.
Yes. Who will be responsible? With entity, normally there's an entity that's responsible for the day-to-day sort of making sure everything's going great for the van or the vehicle itself.
Right, yeah, we would hopefully be partnering with that student organization or also working with them to develop a strategy to have someone overseeing the program.
But initially, until we really nailed down our mission, we would be in charge of sort of driving this and applying for grants and reaching out for partnerships and securing things like that.
Okay, I think I have time for one more. Okay, so assuming the van makes multiple stops in the trip, how do you navigate trained personnel to be able to stop, distribute, and say no to those left in line? So, you know, you're there, you've been waiting. How do you train those folks to sort of be in a social connection with the people they serve?
So we do hope our vision would be, because we are working so close with the community, that we never have to say no to anyone. And when it comes to, Natal, if you want to jump in.
Sure. Yeah, I think the big part here is partnering directly with our food pantries. They're the experts in distributing food, so we're not trying to overshadow them and overstep. We're trying to partner with them and reinforce what they're doing. So whatever the food pantries would decide as the best plan of action, they would allow us, they would partner with us and allow us to come up with that material.
Excellent job, guys. I've run out of time, so beautiful job, well done. And we're going to go on to the next team, and we're going to judge you now as well. So take care, well done.
Thank you.
Hello everyone, my name is Joyce and my team members are Minsun, Hansen, Kate, Krishna, and Nila. We are Team 4 and we have designed a C-Salute to increase healthcare access in New Brunswick one call at a time. First, let's meet Maria. She's a single mother living in New Brunswick who struggles to pay her rent on time and manage her type 2 diabetes. She doesn't own a laptop nor have internet access at home. She also has very limited English proficiency. Maria is worried about COVID-19 and finding transportation to her next appointment, but she doesn't know where to find the information she needs. But it's not just Maria. 1 in 4 people living in New Brunswick do not have internet access at home. 1 in 3 have limited English proficiency and low literacy. New Brunswick's existing healthcare resources are great, but many resources are decentralized and difficult to access without internet and English proficiency.
To create a targeted solution, we met with leadership from local organizations to identify the most pressing health access needs in New Brunswick. A C-Salute focuses on increasing awareness of and access to existing resources, addressing language and cultural barriers, and expanding access to preventive care and chronic disease management.
Now, let's go back to Maria, who's struggling to find affordable transportation to her appointment using existing resources.
The Live Well Tomorrow app for community resources required data that Maria can't afford, while calling the 211 hotline results in hours of waiting. Her appointment is approaching and she needs a ride. What else can she do? This is where a C Salute comes in. A trained volunteer picks up Maria's call. Identifying Maria's need for a ride, they navigate our database of community resources. Filtering her location, income, citizenship status, and insurance information, the volunteer navigates her to Mod of Care's number. They offer to start a conference call to set up the ride and follow up with Maria later about the appointment. But Maria is just one resident among the thousands in New Brunswick. A C Salute's database helps navigate the existing free and low-cost resources in New Brunswick based on the caller's insurance, income, citizenship status, and more.
Our volunteers will answer hotline calls and use our database to direct callers to the appropriate community resources. Trained volunteers will also identify and direct emergencies appropriately. By providing help in English and Spanish during off-work hours, we are accessible to the entire community. We will then follow up on a later date to ensure individuals have scheduled appointments, see if additional assistance is needed, and obtain feedback. Most importantly, we remove the burden on the individuals to find help on their own in a daunting healthcare system. To ensure quality, new volunteer calls and pickup times will be monitored. We will also collect metrics to identify the most pressing needs of the community and deliver this to our community partners so they can address needs on a systemic level.
Now let's discuss volunteers and partners. We will recruit volunteers from Rutgers and other Rutgers-affiliated student organizations. Multiple student organizations have already expressed their interest in joining our initiative. We will also partner with local community organizations to include their services in our resource database and for them to help distribute our flyers.
To ensure our volunteers deliver quality service, we will design and use training materials. First, we'll contact Rutgers student organizations to spread the word about our initiative. Next, we'll release applications and host interviews to select the most qualified volunteers. We will then host our first meeting to introduce the initiative, volunteer responsibilities, and the training modules. These include articles and videos on how to effectively communicate and mock scenarios so students have a better understanding of the real-life conversations they may encounter. We'll incorporate feedback from our partners to identify community needs and prepare training materials accordingly. Lastly, we'll host a second meeting that teaches volunteers how to navigate and utilize our resource database. Our project will thrive with the help of volunteers, and we hope to prepare them as best as possible.
How are we going to get our phone number to the residents of New Brunswick? Primarily, we'll be posting our flyer at partnering religious organizations, schools, and clinics. Digitally, we'll share our flyer on social media and on local radio stations. Our flyer design is simple. We want to let the community know, in English and Spanish, that we are available to answer their healthcare-related questions and to connect them with the resources they need.
Our sustainability plan allows us to increase the capacity of student volunteers as well as expand the project and pursue outside funding once a C Salute is established. This adaptable model can be implemented in other locations to increase healthcare access and information. Our estimated monthly budget is around $1,000. This includes the phone and text line, web domain, and paid administrative and quality control. The allocation of our costs may shift as our operation grows. However, this is balanced by the approximately $1,600 worth of weekly volunteer labor, as well as our team's initial time commitment to the project.
So to wrap it up, a C Salute is a sustainable and low-cost solution that addresses social determinants of health and facilitate health access and information in New Brunswick community one call at a time. Will you help us make it a reality?
Well done. I like that. So thank you very much for that. Now we're going to ask some questions. So we have our judges that are preparing their questions. And so the very first question is from Dr. Marlink. So it's a great idea, he says, and thought that the presentation was well, as I did as well. Giving out information on the phone, including insurance status, will that scare away those who have not got insurance or those who are not yet citizens?
So we do want them to be accessible to everyone in the community. It's optional for them to give us insurance information or any of the other filters we have. So we'll filter based on whatever people are comfortable giving us.
Okay, great. And then I guess once they get to the, be able to provide more information about who they are. Excellent. Okay. I like the way that you guys have leveraged the students in their student organizations as well. Is there a particular organization that you've identified at the university that really has been, really involved in this? Student organization?
Yep, we have reached out to
American Pharmacists Association and Student National Pharmacists Association currently. And we're also planning on reaching out to the Pre-Med Association that's accessible in Rutgers as well.
That's great. So how will you measure your success?
After all the calls are done, we'll be using our administrative team to kind of collect quality measures to see how many calls we are getting so we can appropriately allocate volunteers accordingly to high demand hours. And then we'll also be sending surveys out that will be optional for the people calling in so that they can comment on what improvements we could make, if we need to train our volunteers better. And we'll be also sending this information to our community health partners.
Great. And how will you measure whether or not the participant, the person who made the call, actually got the services that they were actually going for?
So part of our system is incorporating a follow-up process. So during the call, we would ask, or our volunteers would ask the caller if they would like a follow-up after they have gone to their service. And we would be able to use that to further inform. So after each call, the volunteers are going to be marking off kind of what was the purpose of the call, and we can track where people are, what services people are requesting, and then the effectiveness of whether or not we were able to get them access.
Okay. And do you think those in-kind services will, be matched over time? Meaning that your first year, I assured that you had a balance of balancing out the cost, but do you feel that it will continue?
Yeah, so the way that we've sort of designed our budget and our structure will include student volunteers who progress through the system, take on advanced leadership roles as they become more familiar with the program. So they'll be able to get more familiarized with the resources and our community partners within New Brunswick, and then oversee incoming volunteers as well. So we'll be able to expand in that way.
Okay, so time is up. Excellent job, guys. Brilliant work. And we're now going to do our judging. Thank you.
Hi, everyone. My name is Mira, and this is Nate and Nina, and we are Kinetic, a logistics startup dedicated to taking care of people experiencing homelessness. So while most of us know about homelessness, few grasp the breadth of the problem. Our research shows that the daily lives of individuals that don't have a place to live deal with a host of challenges. I'll hand it over to my teammate Nina to discuss these challenges in detail.
Thank you, Mira. Homeless populations face an abundance of pressing concerns that must be addressed. We identified the following as the burdens we thought we could best help alleviate. First, a 2019 article by the National Healthcare for the Homeless Council describes the way poor health increases the likelihood of becoming homeless, which in turn results in poor health outcomes, and the cycle continues. Next, many places already didn't open their bathrooms to the homeless, and the pandemic has just exacerbated this issue. Public urination is on the rise across the country, and as this quote from the Professor Banks of the University of Maryland School of Law demonstrates, this can have incredibly unfortunate consequences for people who have no other options. Finally, many people simply lack the ability to get from point A to point B to access the services that they need. Apps that provide service information for the homeless, such as the Shelter app, can help people find information on public transportation to reach services, but this often isn't the most direct or time-efficient way of reaching the places one needs to go. That's where Kinetic comes in. My teammate Nate will tell you about our idea.
Thank you, Nina. We come up with a 4-step plan comprised the following: portable hygiene services that are temporarily at Kinetic locations, using open space concepts with local stakeholders and businesses, such as Elijah's Promise, on-demand rides to and from Kinetic locations at no additional cost, effective regular transport from our locations to necessary services like Robert Johnson and Elijah's Promise, and forming a robust social network. Now, these are the financials over a 6-month period. Our utilities include our round up to be $64,000, which includes our trucks, porta potties, cleaning supplies, as well as manpower, which rounds up to be about $230,000, which includes our supervisors and drivers and cleaning staff. And a grand total comes up to just short of just about $295,000. Now, our general timeline includes our first month, which is meeting with local businesses and stakeholders within the area of like New Brunswick to determine certain space usage and our plan of action, discussing with them. Our second month goes into initial fundraising opportunities, as well as partnering up and looking for unit storage and truck rentals and overnight spacing. Going to month 5 includes our employee acquisition, such as drivers and cleaning staff and training services, as well as fundraising such as crowdfunding. Later in the month, we go into social media services, that's where our volunteers come into play. Month 6 is when when our implementation comes into play, and that's when we finally decide to go forward with the action plan. And then following the future, that's when we go into more expansion and research, as well as maybe cutting back on certain expenses. Now I'll turn the table to my teammate Mira, who will discuss why we went with Kinetic.
Thank you, Nate. So by no means is this a fix everything solution. Homelessness is a complex issue, and trying to solve all of it with a single solution would only show that we haven't done our research. But we have, and we found that while we can't fix the overarching problem, we believe that the actions that we would take and the decisions made today may go on to improve the daily lives and health of individuals struggling with homelessness by offering them greater dignity, privacy, and respect. We hope that you feel the same. Thank you.
Excellent, excellent. So what we do now is Q&A. So we have 3 minutes for questions from our judges, and they're going to pop up inside my little chat here in a second. So right now, how many people are being served in the community by Kinetic? Or how many people are homeless in the community that will be served by Kinetic? Sorry about that.
No problem. An issue with counting homeless populations in the area, especially in the past year, is the way that we normally develop our figures on this is we conduct what is called point-in-time surveys. And these survey locations will provide food, water, hygiene resources in order to incentivize people to come in for these surveys. And over the past year, because of the pandemic, they weren't able to provide these resources, and the numbers are not necessarily out or accurate. So there are quite a few unhoused individuals, and we hope that Kinetic can help actually provide greater research by just incentivizing people to show up, and also help other populations who may not have access to bathrooms, such as those on long-term drives and truckers and things like that.
Okay, so one question from Manuel Castanedas says, your budget is very high. Assuming that you can get startup funding, how do you plan to sustain this after, beyond 6 months?
Yeah, we know our budget. We know that we had a very high budget. We plan on working and partnering up with Rutgers University, as well as Rise as Promised, to effectively meet our cost measures, as well as some of our other business partners.
Okay, so leveraging is what you're planning on. And of course, these folks are all doing great work in New Brunswick already as well. Okay, let's see. Any other questions? Okay, so as far as the technology, is that something that's proprietary, or did you guys develop it? As far as the information and how folks access the Kinetic, application?
I think what's great about Kinetic is it's a very simple idea. We're looking at renting trucks and renting portable bathroom units. Using these two services, and identifying places where people can go where they need to go, we can solve a whole host of issues beyond that. We looked at rental costs in general, but we'd need to identify very specific places where we can retrieve these units.
Excellent. And then last question real quickly. How do you initially market or communicate that you exist and folks know who you are and you're ready to actually work with them?
We plan on looking at social programs with our volunteers as well as Rutgers students as well to effectively get the word of mouth out there.
Excellent. So our time is very efficient, great answers, and thank you very much. We're going to now start our judging.
Hi, I'm Ryan. I'm from Team 6, and today we're going to be talking about addressing pediatric mental health in New Brunswick High School. So through our research, we've found that in minority groups, high-risk children infrequently utilize mental health care services. And in fact, just 1 in 7 Hispanic children with the treatable condition visit a mental health professional each year. So this led us to ask, what's stopping them from going out and getting these services? So if we look specifically at New Brunswick, there's few, if any, physical barriers to access. There's both in and out of school programs that exist that are entirely free. And this leads us to contend that these barriers are primarily social, specifically stigma and awareness. And these both go hand in hand because they have a similar root cause, which is a lack of understanding of what mental health is and what can be done about it. So when creating a solution, we wanted to target both of these two barriers, as well as target the one thing all New Brunswick students have in common, which is their Chromebooks. So we recommend developing a Chromebook app with a series of tabs to target each step in the value chain, from screening to prevention and then to intervention. So I'll actually kick it to Matt to talk a little bit about screening.
So via our proposed Chromebook app, we would institute weekly screening, which will allow school administrators to keep tabs on students' mental health. And this works twofold. Number one, by directing students in need to one of the other app's resources that we'll talk about later in the presentation. And two, by then tracking improvement in symptoms after intervention. So specifically, the weekly screening will consist of alternating between 2 different biweekly surveys, the PHQ-1, PHQ-9 for depression, and the GAD-7 for anxiety. So students who score a 5 or above on either survey will be directed toward our other prevention and intervention methods that Mayha will talk about now.
As Matt mentioned, our portal will direct users to prevention and intervention-focused strategies. One way to prevent the exacerbation of mental health crises is to eliminate the stigma surrounding the discussion of mental health. We do this through implementing social emotional learning, which is a curriculum that can be integrated into schools' pre-existing curricula. SEL targets skills such as identifying one's emotions, using stress management strategies, and developing and experiencing self-efficacy. There are SEL standards and goals for all New Brunswick public school students, but only grades K through 8 currently have action plans for reaching those goals. Grades 9 through 12 do not currently implement an SEL curriculum, which leaves high school students without a way to regularly discuss their mental health. We propose integrating Headspace into our portal and using it as an SEL tool with New Brunswick public school students ages 13 through 18. Headspace is available on the App Store and has a vast library of short mindfulness and grounding activities. It has been shown to lessen depression and anxiety symptoms and can help students develop emotional regulation skills, which will help them inside and outside the curriculum, outside the classroom. And now to talk about intervention is Krupali.
Our intervention tool is a roadmap to access. This would be a system designed to present the users with resources most relevant to them. On this tab, users would first be asked a set of questions, examples of which we've listed here. Based on the responses to these questions, an if-then logic system would be employed to retrieve resources from a built-in database that are most applicable to the student. The primary purpose of this system would be to increase the student's awareness of resources most beneficial to them. We wanted to target the lack of clarity when navigating mental health resources through a system that forms a bridge between the needs of the students and the pre-existing resources. The increased ease and accessibility, we hope, will subsequently increase help-seeking behavior, active participation in their own mental well-being, and resource utilization by all the student users. This slide provides a list of categories of resources, as well as an example within each category of the type of resources that could be presented to the student at the end of the roadmap. Now, Abiola will talk about the next steps.
The next steps is where we begin the process of school implementation and software development.
Between April and May, we will pitch and await approval from the New Brunswick Public School. During the waiting time, we'll begin the interface design. Between June and July, we will evaluate possible developers and begin the pitch proposal to Headspace. As the development begins between July and August, we will integrate Headspace into the app. The month of August, we'll begin testing the app in preparation for launching in September. This project budget will be about $2,000 to $100,000 based on the type of partnership we get. Previously in March, we reached out to Headspace, but with no response. However, we hope that the New Brunswick Public School will follow up with a proposal, which led us to a plan B to continue the app development as we attempt to integrate another SEL curriculum into our portal. Some of our limitations are finances, which will be based on our partnership and continuity of the project after we graduate. Regardless of the limitation, we can still make a huge impact in the New Brunswick community. Thank you.
Well done. So now we have some Q&A that we'd like to share with you guys. So the first question I have is, how do students themselves, this 13 to 18 group, know if they've been flagged with a mental health issue? I just want to go back to that point you guys made about who enters the information about the child that has the mental health issue.
Yeah, so great question. So I think that the most relevant aspect of your question is who's been flagged for usage of our prevention and intervention methods. So going back to what I mentioned earlier in our screening, so ideally every student with a Chromebook will be using our portal, and every student will then take our two screening surveys that I mentioned earlier. And any student that scores a 5 or above on either survey, which indicates mild anxiety or mild depression, will then be delegated to our other intervention and prevention methods.
And how's does the system or the plan that you guys have the bandwidth to share information back and forth between the issue and then back to the administrator? Like, is there a two-way for folks to be involved throughout the entire process?
Yeah, great question. So we've actually thought about this a little because there is going to have to be a significant back-end effort in terms of operating this whole database. And the big idea that we have right now, which we actually want to include with our pitch to New Brunswick Public School when we go about it, is starting some sort of like a club in school, because they already have a pretty strong technology department in place. And I know in other high schools, they have things like robotics clubs, things like that for people interested in technology. This could be a great way for people to get that technology experience while also performing social impact and helping out their community. So that's our initial idea for that.
Okay. And how do you go about getting approval from the school district itself?
Yeah, so our first step there is actually to develop a prototype within our team, and also alongside our advisor, Dr. Gracias, develop a pitch and actually deliver that pitch to the Board of Education at some point in early June is our goal for that.
Okay, and that's the same thing with parental consent as well?
We expect to, over the summer, when we implement our marketing process, we do expect that we would pitch this to parents, and that parents would consent to their children using this Headspace portal, although since there is no requirement, they aren't required to say that they would be allowed. And in addition, we're not taking over any sort of treatment care, so we wouldn't need to get care from a healthcare professional.
Excellent, excellent. Well done, guys. Good presentation and a really good exchange with the Q&A as well. So thank you very much. Our time is up. Now we're going to judge. Take care.
Stepping on a scale or taking blood pressure, although simple screenings can undoubtedly save a life. Ladies and gentlemen, I present to you PROPS, partnering with religious organizations for preventative screenings. Here's our team, and let's begin. We first performed a SWOT analysis to characterize the New Brunswick immigrant community. In discussions with local religious organizations, we found that the community is more religious than the state average, with 57% of residents reporting being religious and a majority of them identifying as Roman Catholic, making churches and other religious centers a hub for community connections and strength, and also showing opportunities for partnership. As for weaknesses, 19.7% of residents are not covered by healthcare, a group made up of largely undocumented, low-income Hispanic individuals who must actively avoid deportation. Additionally, 34.4% of NB residents live below the poverty line, and 24.5% do not have home internet access. Still, this is a resilient, tight-knit community. I'll hand it off to Nidhi now to analyze the problem.
Thank you, Maria. Out of all the problems faced by this community, our group decided to focus on poor healthcare access. So we did a root cause analysis to find out the various barriers to healthcare access within this community. First and foremost being the linguistic barrier. The people of this community mostly speak, read, and write in Spanish with limited proficiency in English. Thus, they have a hard time communicating with their caregivers and traversing the US healthcare system in general. Next are the legal and regulatory barriers. As these people are mostly undocumented immigrants, they avoid the healthcare system where they feel at risk of getting caught. Next, a lack of health insurance results in large out-of-pocket medical expenses. Because of their undocumented status, they are not eligible for regular Medicaid and oftentimes are ineligible for employer-sponsored insurance. Lastly, cultural barriers can negatively impact access to care as many community members rely more on traditional herbal medicine and the concept of preventive care is not common practice. Next, Jerry will discuss the specifics of a solution.
Thanks, Nidhi. Our program centers around three core elements that focus on putting power and resources directly into the hands of our target communities. First, we aim to provide training to members in our partner religious organizations on how to take basic vital signs such as blood pressure and height and weight. For much of our target population, this makes getting a basic checkup as simple as stopping by a healthcare station in or near their place of worship to be cared for by people they know and trust. This mitigates several key factors involved in healthcare inaccessibility for our target population, including fear of deportation, as well as financial, geographic, and cultural barriers. Of course, we will provide our partners with all the equipment needed for these stations. Finally, we will work closely with our partners, both directly and through a steering committee of community leaders, to develop culturally appropriate educational materials that stress practical and feasible interventions. Next, Carrie will discuss our plan for implementation.
Thanks, Jerry. Implementation will begin with contacting various religious organizations throughout the New Brunswick community. A total of 5 prop stations will be set up initially, with each organization specifically chosen to maximize the number of people reached. Student volunteers from Rutgers University will be recruited to educate point persons available within the religious organizations, as well as assist with screenings and referrals when necessary. The team will then purchase materials and develop healthcare information, which will guide community members in deciding when to seek medical attention. Each prop station will have its own blood pressure cuff, thermometer, pulse oximeter, scale, wheelchair, and personal protective equipment. All of the items included in the prop stations, with the exception of PPE, are one-time purchases which will minimize maintenance costs of the program. With 5 total stations, the entire project will cost just under $3,000. Next, Nazia will discuss the timeline for our solution.
Carrie. As of now, we have reached out to 5 religious organizations of various denominations within or near the New Brunswick community, and we expect to distribute the toolkits to them within 3 to 4 weeks. Then we will conduct volunteer training to introduce the program and teach proper usage of the materials in the toolkits, which we expect to take around 4 weeks. Afterwards, we predict the project rollout to begin and continue for the rest of the year. We will follow up with the communities every 6 months to troubleshoot any issues and assess the impact of our program, and we expect this evaluation to take around 3 weeks. If we do expand this program outside of New Brunswick, all of the phases of this timeline will have to be repeated. Katie will further discuss on how props can be implemented outside of New Brunswick.
Thanks, Nazia. Because the operation of props does not require outside professionals such as trained doctors or nurses, it is a solution that is self-sustaining. There are churches and places of worship throughout the country that could implement props as a way to increase preventative care in their communities. Although screening for blood pressure and taking height and weight measurements may seem small, these measurements can provide indications of whether community members should seek medical care for a possible condition. Overall, PROPS not only has the potential to revolutionize the way we view healthcare access and delivery, but also can provide assistance to people nationwide, regardless of their religion or immigration status. Thank you.
Excellent presentation. So now we're going to go into our 3 minutes of Q&A. So I'm going to be monitoring our little question that pops up. I'm going to fire it at you guys. So this is well designed. Sounds like you guys really put a lot of work into it. I'll fire off a question while I'm waiting for a written one in the chat. So the manning of the stations at the religious places of faith are just community members, or who's actually physically located at the various houses of worship?
Take this. So our idea is really just to enable and empower the community to, help them access healthcare themselves. So initially, it's going to be our own team of volunteers consisting mainly of students, and this could be medical students, pre-meds from undergrad, or just anyone interested. And they would go in and train members in this community. And after that initial training, right, they then would be the ones taking the vital signs that we hope they can, like blood pressure or heightened weight. So this really has the potential to be really self-sustaining, and that once we've trained them and given them the equipment, they can really, do whatever they want with it.
Okay, great. So next question. So basic health might not be a priority for a lot of folks. Hold on a second. For a lot of residents. Have you considered using COVID or another underlying preventative health concern to get resident buy-in? How do you get the residents to basically see this as a go-to place?
I can take this question. So in our discussions with local religious organizations, we reached out to several churches, mosques, and synagogues in the New Brunswick community. We found that the religious organizations themselves have a very tight-knit community, and that the religious leaders, whether those are rabbis or church leaders, would definitely facilitate this process because it does serve as a safe space. And I think being served by members of your own community and people who care for you can definitely mitigate a lot of the fears in seeking out medical care in the first place. So like Jerry mentioned right before, empowering people in the community.
Okay, and how will you measure your success? Beyond just the numbers of folks that have visited, is there any other measures that you have?
Yeah, so I can take this question as well. So we plan to have a liaison or a point of contact with every religious organization who would serve as kind of a contact for feedback. We also plan to collect data on people who use the services using a number system, so there'll be no identifying information. And this can definitely collect really good health information on the community as well.
Okay, I got 30 seconds, but I'm going to squeeze it in here. So referrals. So we do see some patron that's developing, and someone really does need to go get services beyond this. How does that work?
I think this really is a core part of our solution. We want to sort of serve as a gateway to more comprehensive healthcare services. So we're going to be, giving our community members and partner organizations, referrals to places like, the hip hop clinic that Dr. Lin runs. And that's really important because, they don't care about things like documentation status or insurance status. So this would be a great referral for people who need more comprehensive care.
Excellent. So our time is up. Thank you very much. Well done, guys. We're going to go do our judging now.
Meet Angela. Angela is only 8 and lives in New Brunswick, New Jersey, and is a part of a large Hungarian immigrant community. She lives with both of her parents, her grandmother, and her brother and sister. When COVID-19 hit, her parents increasingly struggled to find work that kept the family safe while still bringing in enough money to cover her basic necessities. With little money left from rent, a lack of transportation, and a lack of major grocery stores, her family frequently struggles to find affordable and healthy sources of food, often having to pay for taxi rides or carpooling with neighbors. Over the past year, Angela's family has had no option but to take advantage of local food pantries, but even this solution is plagued with problems. Most pantry organization hours compete with her parents' work schedule. Angela's grandmother is at high risk for COVID, so she's unable to leave the house, and the school's local food delivery service has reached capacity. Angela's family is just one of many in New Brunswick that are food insecure. Back in 2012, 41% of New Brunswick citizens reported being food insecure, and it is estimated that this number has only increased due to COVID-19. As a part of this case competition, we've been tasked to find a solution to this surging public health concern, so we went directly to the organizations already supporting it.
Over the past 3 months, we've had the opportunity to speak to several community leaders and stakeholders who are on the front lines of food security in New Brunswick. As we developed our ideas, we went back to these same organizations again and again to learn what logistically would and would not be feasible to support the food security network in New Brunswick. While each had challenges specific to their mission, similar themes emerged and issues relating to lack of transportation, knowledge of available services, and culturally appropriate foods were frequently voiced. Most of these same organizations, plus more, have been dedicated to serving the New Brunswick community for years, if not decades. In the face of COVID-19, we believe in order to develop a sustainable and credible solution, we must partner with these same organizations. Our solution, ZipP Pantry, partners with existing organizations to bridge the gap for individuals who are unable to access the existing food security networks in New Brunswick due to any physical, economic, and/or social barriers. ZipP Pantry will be the direct link between these organizations community-wise and those individuals acting as direct service that brings foods from existing pantries to people who are in need. Recipients would be identified through our community partners, schools, and religious organizations. We would then source food through existing food-based organizations and deliver it straight to the individual or family in need. The key to our initiative is our proposed alignment with Rutgers University and Rutgers Against Hunger. Our plan is to utilize zip cars to deliver foods to the individuals in need, and we anticipate the annual membership and driving rates to cost approximately $10,500. The primary manager of ZipP Pantry could be a graduate student working on an applied practice experience or fulfilling an assistantship position. Additionally, the undergraduate Rutgers Against Hunger has a robust volunteer core we hope to involve in this initiative. In order to give back to our partners, we would provide each with an incentive that would align with the organization's needs, such as a freezer or general monetary contribution to support the pantry. Overall, we anticipate that this initiative would cost less than $40,000 a year between the staff cost, Zipcar membership, and incentives.
The process would look like this. If officials at the local school recognize Angela's family's urgent need for food, but are beyond capacity to provide or deliver, her family would be directed to our initiative. We would then contact an organization like Emmanuel Lutheran Baptist Church, a community partner that has agreed to supply pantry food to our cause, and then deliver it by Zipcar straight to Angela's door.
The best part of this solution is that it's scalable. As we become aware of additional needs and wants within a community, this service can adapt. For example, we can expand to partners within more organizations, within Rutgers New Brunswick, or support initiatives like the New Brunswick Community Farmers Market or the Fruits and Vegetables Prescription Program. Constantly engaging and connecting with community stakeholders and organizations allows us to continually learn how to best support the residents of this dynamic city. We're already investigating grant opportunities that are offered to support the New Brunswick community, such as through the Robert Wood Johnson Foundation and St. Peter's University Hospital, both of whom are major community stakeholders. These healthcare organizations routinely perform community needs assessments that have often highlighted the importance of food security in New Brunswick.
With ZipP Pantry, Angela's family and others facing similar challenges can be supported through their time of need. We thank you for your time and attention, and we look forward to answering your questions.
Excellent job, guys. Well done. Great presentation. So now we'll move to Q&A. And so what I'm going to do is I'm going to monitor the chat here and we have some questions. So the first one comes from Dr. Suley. For individuals that, for personal reasons, do not want to identify themselves as in need to an organization or food pantry, can individuals access the service or contact you directly, or do they have to be identified by organization or school? So is this have to go through an organization, or can they do it just as themselves?
Yeah, for sure. I mean, we're hoping that by putting the and aligning it with Rutgers Against Hunger and these local organizations, it's helping us build, credibility within the communities of the organization that can feasibly provide services. And so that's kind of our stepping stone of being, like we are an organization that exists and can help. But yes, we do plan on having that as an additional option.
Okay. So how many people will be served by this plan? If you figure 4 hours a day for 4 days a week in 52 weeks a year. or did you guys have your own sort of calculus for how many people you think you can serve with this program?
Right, so our goals right now are defined by the capacity of the zip cars that we'll be using to deliver food and the availability of the students. But our goal within the first month is to reach about 100 families. We do want to, as Julia mentioned, not only reach people that are within the network that we're working with, but people that want to reach out without giving too much personal information. So that would also allow us to deliver food not just to homes where a lot of the New Brunswick population is insecure with housing, but deliver it to public spaces where people who don't want to give too much personal information can also pick up food.
Okay, so initially, 100 families served. Is that going to be sustained over time, or do you guys see this growing as you progress through this?
We do anticipate it to grow. Obviously, this is, like Claire said, contingent upon staffing and availability of volunteers. So how fast it can grow is something that would be limited by the just progression of the project. And if people are seeing this as a resource that they need and that they want to use, we've through conversations with the organizations that are currently serving New Brunswick do think that this is something that would be used. And we did actually have confirmation from one religious organization that we spoke with that they do think that this is something that their community could benefit from as well. So how it then further expands, like whether that expands into more of a market, would be, is this something that the community wants? We do want that feedback from the people that we are serving.
Excellent, perfect timing. Our time is up, our 3-minute Q&A. You guys did really well. So we're now going to do our judging, and this will be the end of the presentation. So thank you very much. Well done.
Here we are. Welcome back, everyone. I hope that while the judges were deliberating, you all had a chance to step away and catch your breath. Can I just say, amazing pitches by everyone. We're so proud of you, and we're proud of this event. Many global health case competitions are largely hypothetical exercises, often conducted just over a weekend or over the course of 1 week. But based on feedback from student focus groups and a university-wide student survey, and based on our approach as an institute, we wanted to take a more comprehensive approach, include input from community stakeholders, build relationships, and have real-life impact. A little over a year ago, Rutgers Biomedical and Health Sciences invited proposals for its new Inclusion, Diversity, Equity, and Advocacy Innovation Grants, calling for, quote, action-oriented projects that strengthen a sense of community. So this was the perfect opportunity to initiate the Institute's first university-wide interdisciplinary case competition. And we have been working on this ever since. Of course, none of this would have been possible without the help of our wonderful faculty and several very energetic members of our student council. And with that, I'm handing it over to my colleague, Arpita.
Thank you, Angela. I'm very excited to talk with all of you again. In the words of Helen Keller, alone, we can do so little. Together, we can do so much. This global health case competition is a testament to our collective effort. I want to take a moment to acknowledge our phenomenal student planning team. There's Rohit and Haj, along with Aparna, Devain, Cheyenne, Giovanna, Adrian, and Claire. This case competition has been a labor of love for them. I want to give you a glimpse into the time and effort that went into the planning behind the scenes, of course, by these confident and strategic leaders with guidance and support by dedicated faculty advisors. The case write-up was an extensive process that involved gathering input from community stakeholders, burning the midnight oil while writing the case, of course. The educational workshops that you all participated in and enjoyed so much took months of planning and stellar coordination. We had approximately 90 students who applied for this case competition. It took some serious strategic thinking to identify 50 participants and assign them to 8 teams in a fair and thoughtful manner. Please join me in a big virtual applause to our student planning team. And now I'll pass it to Dr. Kevin Lyons.
Thank you for everyone for participating. This has been an eye-opening experience for me. I got to learn a lot from our teams. Your insight into what you did was brilliant. I also like to thank the judges who participated in this process as well. It took some time for us to collaborate and make sure that we were doing our jobs as judges to make sure that all the hard work that you put into this was evaluated properly. Some of the things that we were looking for were the same themes that were coming through in the presentations. We wanted to make sure that the teams had an opportunity to really identify what the issue was and then be able to put some content and some analysis behind that. And to really think about this real live opportunity for this particular project to become a reality within the city of New Brunswick. So the evaluation that the judges used was to actually look at that and come to a fair and I think a great conclusion of who our winners are. So all the teams that presented today, I really felt that there was some theme that rode right through it all, and that was the collaboration that you all sort of weaved into your presentations, with the university, with our strategic partners in the community, faith-based organizations. It was really well conceived and really well done. So thank you very much. So I'll hand it over to Dr. Sule.
Great, thank you. And hi, everyone, and thank you for joining us for the last couple of hours here. And really a huge thank you to the whole team for putting this on. It truly has been a labor of love, and I am really proud to be part of this. And what an inspiring set of ideas from everyone. So I'm just so impressed by the amount of work that all the teams put in, and their presentations clearly demonstrated that. I wear a few hats in my work life, one related to emergency medicine, and where I clinically practice and teach, and the other related to global health. And people often think of the global health part of it as being all things international. But if there's one thing that became really clear during the past year, it is what several of us have really said for a long time, which is that global health is not just a matter of health and goodwill and being nice to people. It's also about the economy, about people's livelihoods, about global security, including in our backyard as well. As I worked clinically in the emergency department over the last year, it became really clear to me that ours is a population throughout the state, there are segments of it, that are already subject to social, economic, racial, and health injustices and inequities. And now with COVID and a pandemic, all of those were that much more exacerbated. All in this environment, it became especially important for us to think beyond our own safety and well-being. And that is what I think every participant, every team in this really did. They thought beyond the privileges that they have of studying and working from home with Zoom, or ordering groceries for home delivery, having multiple rooms in their home with enough bandwidth to do virtual school. These were all some of the challenges that they really looked into in depth. And as each of these pitches really captured the essence of what we were looking for. Two things that I've often seen as a roadblock in global health projects has often been the lack of a good needs assessment, and the other being just giving in too easily to the naysayer, saying, nah, that's not going to work. And the common theme that I saw today was really the creativity and willingness to engage and push those limits a little bit as well. So thank you for having me be part of this, and all 8 teams should be incredibly proud of the work that they put into this, and the effort, the collaboration, as Dr. Lyons said, is just impressive. Thank you.
Okay, and so now comes the moment that we've all been waiting for. It's the awarding of the first, second, third place teams. Dr. Sule, Dr. Marlink and myself will be announcing the third, second, and first place winners tonight. Again, thank you again for all your hard work that you put into this. We really appreciate that. And so I have the honor of announcing the third place winner. And the third place winner, and this is for all the teams, there is a cash award and there is resources and support for carrying forward your idea and concept, which I think is great. So the third place winner and recipient of a $250 award plus implementation support is team number 6. Congratulations to team number 6. Well done. Okay. I would like to, again, just, congratulate. I mean, that was a really well-developed plan. It was really thought through. And we really appreciate all the work that you put into that. So team number 6, congratulations. So up next, Dr. Sule.
Thank you, Dr. Lyons. It is my honor to present the next award. In second place, and the recipients of a $500 award with implementation support is team number 7. Congratulations to team number 7. With their props initiative, we were especially impressed by their organized SWOT analysis and using an organized root cause analysis framework as well to really look at the problem in depth and identify what the issues were. And most of all, I think the practicality of it with leveraging a lot of existing organizations and coming up with a solution. I think this is really going to be a very basic but very impactful intervention, and we look forward to seeing it come to fruition. With that, I'm going to hand it over next to Dr. Richard Marlink, who will announce the first place team. As you know, Dr. Marlink is a director of the Rutgers Global Health Institute, and he has been hands-on throughout the entire case competition, from inception and planning through advising, judging, posting comments in the chat, welcoming everyone, and now, of course, celebrating. So with that, Dr. Marlink, if you would do the honors.
Thanks, Harsha. I'm really excited we've reached this point in our competition. And after we applaud the first place team, team number 8 was the first place team. And I'd like to congratulate her. We all virtually applaud that team. And I wanted to just transition, though, that it's great that the teams are all winners and will be receiving certificates of honorable mention and participation. We hope in this will be something that you're proud of, that you'd put on your resume, that this is, again, it was very difficult. The scores were very tight. I think that's why it took us a long time to get back to you. But I did want to, again, sort of overall thank not just the teams, but the planning team and my fellow judges, Michelle Wilson, Miriam Merced, Kelly Moore, Manny Castaneda, and Harsha and Kevin, who are here for helping with this, as well as our student council faculty lead, Mark Robson, who I think is here, but we don't see everybody on. We don't see everyone's camera, obviously. But each of you 8 teams tonight had the benefit of a great faculty mentor. So I wanted to thank them. They're all here with us. And over the last 10 weeks, meeting with you and advising throughout the process. Again, I thank them for their time, and their experience was meaningful and valuable. I wanted to thank Angela and Harper, who in many ways putting in many hours to manage this competition, going back, getting the seed grant from the inclusion and diversity pilot seed grants. And we wanted to just thank them, along with Laura and Lori from our communications team. But first, again, going back to what is clarified, what is meant by winners. I think we have our 3 first, second place winners, but all of you I think we were also very impressed with each team's effort. And I want everybody to sort of step back and think about what you've done. You all were willing to put in the work for an experience that's not for credit, not required, but you wanted to do it, and you came together. Second thing is, I wanted to say you came together as strangers, pretty much, and became a team from different backgrounds and experiences. But that's really how you do global health, is through creating teams and partnerships, which you did by creating your team from strangers, and then going out and finding your partners in communities and organizations or other parts of Rutgers or other expertise. So the solutions you proposed all work as global health solutions. They represent the hours and weeks of your hard work, and you all really gave it your all. So I think everyone's a winner here, and I'm biased because I'm also rooting that you all are showing your bias for being wanting to go into global health or a global health related profession, which can be everything from engineering to communications, from public health to emergency medicine, from business to law. They can all be in global health, especially realizing that health inequity needs to be addressed in our own backyard, not just in some other country. So I hope you all go into global health, and many of you I know will, no matter which profession you pursue. I hope, lastly, that this has made an experience that has made you better. It certainly has made me, and I know the judges, our staff, our faculty, we're all made better and excited by being involved, learning a lot. Even though I've been doing this for over 35 years, I guess I'm the old man on the block, but I learned a lot tonight and was excited by the ideas. As you may have seen me chat in the side, that the ideas are all very innovative and doable, and that those are what we really wanted to see. So I congratulate you again. I wanted to thank everyone watching. So you're attending Rutgers Global Health Institute's first global health case competition. So I hope you all were as blown away by the competition and by the students' results as I was. And I hope you've all learned something as I did. And I thank you again, and good night.